at Memorial Health System in Abilene. We work as a critical access hospital. We've got 25 beds, our own laboratory. Laboratory consists of multiple different departments. So you got your phlebotomists, they're bringing the specimens into the lab. Then you got chemistry, it's the workhorse of the lab, that's where most of the testing is done. Hematology, very specific, where it's just dealing with your actual red blood cells, white blood cells, platelets. Then you've got microbiology, dealing with all the little microorganisms. And then blood bank department, that's where we can safely maintain blood for patients who need it.
A phlebotomist is a person who does collections. Any bodily fluid, mostly blood. It's very easy, start to finish. It's probably only 3 minutes, but it's a nice, fun process, a nice little start to our day, and hopefully their day. I can't tell you how many times we've been complimented on not only how fast we are, but how painless it's been. And I think a lot of that has to do with our demeanor, because a lot of us are very open, very talkative. We remember their family members' names. So even though we're doing like phlebotomy, it's a little more than that, and they trust us. As a phlebotomist, when you learn how to stick, sometimes they have these artificial arms that you can practice on, which are great, but sticking an actual person is better. But you can do on-the-job training for this. You don't have to go to school first to be in this job. It is very attainable as long as you're willing to learn. Anybody can come do this.
In the chemistry department, that's where you're dealing with multiple different bodily fluids. You've got plasma, serum, urine, spinal fluids, and you're basically just checking for a wide range of different tests depending on what the doctor's looking for. Chemistry can be split up into a couple different responsibilities. If you're working day shift, primarily your job is to get results out to providers and interpret those results. That's where the education comes in. You need to be able to make sure this result you're giving a provider is valid, and ultimately that's going to lead to how that provider is going to treat your patient. If you're working on a shift, say second shift or night shift, where the workload is a little bit less, your responsibility is going to primarily be maintenance. So you're doing the routine cleanings, the tweaks here and there. That's going to make sure day shift is functioning smoothly, giving accurate results. Again, that's probably one of my more favorite aspects of chemistry is when something isn't working. I really enjoy the troubleshooting aspect of going from broken to fixed. It's very satisfying.
Hematology, we look at the red blood cells, the white blood cells, and the platelets. We're looking for abnormal cells, we're looking for normal cells. If we see abnormal cells, we can send it off to a pathologist to review to see if there's further problems or further testing that needs to be done. We also, in hematology, do what's called sedimentation rates, and that's how fast the red blood cells settle and looking for inflammation. We do coag or coagulation to see how quickly or how long it takes for your blood to clot. Hematology benefits patients by helping doctors diagnose and get right treatment at the right time. For example, with white blood cells, the instrument looks at them first, and then it'll flag and say, hey, there's a problem here, we need a set of eyes, take a look at this, and then we count 100 white blood cells. We differentiate what each cell is, and if we see any abnormals, we send it out to a pathologist for review that they may be able to see cancer that way. We can also help people if they have platelet disorders. We can see that and help them get more testing to further diagnose and see what the problem is and what treatments they can do. And then red blood cell morphology tells us a lot. It tells if someone's anemic. It'll tell if they need a blood transfusion. If their hemoglobin's too low, they don't have enough blood, they're not getting enough oxygenation throughout their body. Microbiology, we get to identify the bugs or the organisms that are causing infections. We do urine cultures the most, but we also do wounds. When we have, for example, a urine that needs cultured, we plate it and we let it grow until the next day. And then the next day we look at the Petri dish to see if there's any organisms, any bacteria growing on the dish. And once we see what we want to see or don't see, if we don't see it, that's good for the patient and we can just set that aside. But if we see growth, we want to identify it, and we do that by a multitude of tests. For example, there's an oxidase test, a catalase test. You have your gram-positive bacteria, your gram-negative bacteria. You treat them differently in how you identify them. We run the microscan is the name of the instrument we use that identifies and gives us sensitivities to tell us which antibiotics work and which ones don't. Therefore, a doctor will know if the patient's on the right antibiotic or if they need to make a change.
In the blood bank department, the majority of what we do is determining blood type. We can do that by taking little segments off of the donor unit, make a red blood cell suspension out of it, and then from there we can use our pipettes and aliquot a specific amount into gel cards. The gel cards contain antibodies that react with the antigens on the red blood cells. Based on how those reactions occur, we can determine what the donor's blood is. Blood bank's very important to our patients because it's a life-saving treatment. If it's not done correctly, it could harm a patient. So it's very important that we are determining donor blood is compatible with the recipient before we introduce that donor unit to the patient.
I love my job. I love what I do. I like working with my hands. I'm not really a desk kind of person to sit at a computer or do paperwork. So I love working with my hands. I love variety. I work at one station, then turn around, go to another station, and it's never the same thing twice. So it's fun.
There's a lot of different ways that you can get into the lab field. A lot of people start off with being a phlebotomist or a lab assistant. All you need to do that is just a high school degree, or you could go straight to school, become a medical lab technician with a 2-year associate's degree. A 4-year degree will get you up to a MLS or medical lab scientist. And once you're in the lab, you're not really just stuck being a tech or being a phlebotomist. There's always different ladders you can climb. Just because you're not face-to-face with patients every day doesn't mean you're off in a room by yourself. Here at MHS, we've got a great culture. We laugh, we joke around, we have a great time with each other. There's also internal customers that you're going to work with on a day-to-day basis. You're working with nurses, you're working with doctors, you're working with radiology. The lab really interacts with all departments within a hospital.
Well, I think if you are considering a career in lab, starting as a phlebotomist is a wonderful way to do that. It gives you a baseline of what you'll see. You know, what you're going to do on the daily or what you could potentially be doing, either staying where you are or, you know, leading up to that. So you get to see everything that you're gonna do and realize that you're not only just in the lab, you're not only just drawing blood or just collecting urine samples, like you get to do a lot of really cool things.